next we have navicular disease syndrome or podotrocleitis. Okay, so this is a lot. What is it? So you usually see chronic forelimb lameness, so just the front feet, and what you get is pain from the navicular bone, hence why it's called navicular disease. And it's closely related to the structures around the navicular bone, which I'll show in a minute. So includes the collateral suspensory ligaments of the navicular bone, distal sesamoidean impar ligament. So if you see distal, that's what this is, distal sesamoidean impar ligament, the navicular bursa, and the deep digital flexor tendon, which we already discussed with laminitis. You'll see degeneration of the structure and mechanical function of the cartilage, subchondral bone, and surrounding soft tissues of the navicular apparatus. Navicular syndrome refers to pain in the heel specifically, so the back of the foot. So imagine this is the front, this is the back, it's in the back. Usually it occurs in sport horses between 6 to 15 years old, and we're going to find out why. So what the hell is the navicular bone? So if we zoom into here, this teeny tiny bone is called the navicular bone, and this diagram is very helpful actually. So you have the navicular bone here, you have your deep interdigital joint, that's what I assume it's called, phalanx 2, phalanx 3, so this is the distal phalanx, the impar ligament, the deep digital flexor tendon lines the outside, the palmar side of the navicular bone, and you have the navicular bursa deeper into the deep digital flexor tendon. So all of these are affected. So if you just remember this very helpful picture, so this is the joint, impar ligament, DDFT, navicular bursa, navicular bone, you'll remember what parts are affected by this disease. It's as simple as that. So how does it occur? Basically two things: abnormal forces on the navicular bone, and it can either be from excessive loads applied to the foot with normal conformation. So let's say even if the shoeing is fine, you're placing too much load on this bone anyway. Or what happens is you have normal loads, but you have abnormal foot conformation. So normal foot conformation, but too much loads, normal loads, but abnormal foot conformation. So there you go. And what does this result in? Basically abnormal physiological biomechanical forces of compression on the navicular apparatus. So what you get is abnormal bone remodeling, hard and soft tissue degeneration. I'm trying to find something useful. Let's try the picture actually, it's a bit more helpful, and even if you look at this. Okay, so now I'll zoom out. So so you have dorsal to palmar imbalances. So what does this mean? Imbalance between this and the underlying side. So what you get is broken hoof pastern axis. What the word looks like, and what you might get sometimes is like a long toe, low heel, maybe short toe, high heel. Basically these aren't meant to be normal. Like it also shows some examples, like if they're both low collapsed heels, typical in thoroughbreds because they're usually used in racing. It talks about medial lateral hoof imbalances, so imbalances between both sides, small feet and reverse palmar angle, working on hard surfaces like this, and contracted heels. So I imagine these are like heels that are like this basically. So there is like a congenital component, inherited I should say. So it says if you look at the navicular bone in an x-ray, the proximal border of this bone can be convex in, say, Frisian horses. In horses with a straight proximal border, they are moderately predisposed to the navicular bone disease, and horses with an undulating or concave proximal border are more predisposed to the disease, like Dutch warm blood horses. So Dutch warm blood horses are more likely to have something concave, whereas Frisian horses are more likely to have something convex. So in terms of when we get a horse, how do we suspect that they have this disease? Well, of course, we always gather history no matter what. So horses will have chronic bilateral or unilateral forelimb lameness, and it could be acute. Usually that's the case. They don't perform as well. They're quite stiff. They like have shorter strides. So this is the distance they make each walk. They don't want to turn. And yeah, you might even see lameness on harder surfaces. We said harder surfaces aren't always good. So like, for example, this is probably better, even though it's just poo. So yeah, you can see here, this horse is kind of tiptoeing. This is because the horse is avoiding loading the heel region of the foot. So where you get our hoof imbalances and a forward stance with the front limbs or broken limb axis at the carpus, the horse may tend to point to one forelimb or alternate pointing each forelimb. And yeah, you can also see clinical signs when the horse is moving. So horses show mild to moderate, so grade 2 to grade 5 unilateral intermittent lameness when trotting. So think about trotting. You'll see stilted gait when, you know, it's in a bilateral case. So lameness isn't always just in one hoof, it could be in both. Because this type of lameness usually affects both front feet, but the more lame one will be obvious. And lameness worsens when they're sort of walking in a circle on a hard surface with the affected limb on the inside. And horses tend to land toe first and may occasionally stumble, because of course this isn't normal. They should be walking like this, not like that. And yeah, if you do the phalangeal flexion test, it won't be helpful because some horses may react fine to that. So this has been a bit long, so we'll come back and do diagnostic tests.